Okay, your meeting is recording. You're good to go.
Good morning, everyone, and welcome to the Weston Board of Ed Policy Subcommittee meeting. Today is Tuesday, March 5th, and we've got a lot of information to cover here. So I think the first thing we need to do, I'm trying to pull up my, sorry. The first thing that we need to do is, do we need a motion to open the meeting, or are we good?
No, go ahead.
Can never remember with these things. But I think the
You
first thing
can
we need
start
to
it
do.
on your own. You don't need a motion.
Great, let's just roll. We do need to approve the minutes from last meeting. I hope everyone had an opportunity to take a look at them. I didn't see anything that needed to be changed. If everyone is okay with them, can I have a motion to approve meetings from, or the minutes from last month?
Motion to approve the minutes from last month.
Thanks. Can I have a second?
Second.
All right. Meeting minutes are approved. So let's just hop into the meat of this meeting. I think that we decided who is going to go first on this one. We're going to go with the administration of medication. So Kristen, I believe, do you want to start?
Sure.
Or do you want to do immunizations first, or is that all? It's good.
Immunizations is really quick. It's essentially, there was a change recently from the state of Connecticut where there is no longer an acceptance of religious exemption. So there's really specific language since last time we updated the policy, where our policy still states that you can have a religious exemption, and that is no longer allowed legally in the state of Connecticut. So I just want the language updated to reflect the current laws of the state. So that's pretty much what that one is.
Okay. I did a
page.
quick question on that, Kristen.
Sure.
What's the significance of April 28th, 2001?
That's when that was the deadline that you had to have your certified, I have a religious exemption.
Okay.
By the state of Connecticut in order to be grandfathered into the not having to follow the new law.
Okay. All right.
So anybody that after that date provides us with a religious quote unquote exemption cannot attend we can deny them access to public school based on the law of Connecticut. And the new language states that anything that says that they have an exemption, religious, has to be a Connecticut exemption. It can't carry over from another state. So if somebody's transferring into the district from another state and had a religious exemption, let's say in New York before that date, it doesn't transfer over here because it wasn't Connecticut granted.
Okay. So. All right. Thank you.
Because I'm still very new to these meetings, do you need me to go page by page through that?
I don't think it does. Did any of the other members have an opportunity to read through the entire immunization policy as it was updated? And if so, does anybody have any specific questions? Just because out of time today.
But it's a requirement. It's not as if
it's a requirement. It's really just making our policy language match that is already part of the state. So I just like things to.
It's not as if we can opt out. So
we cannot opt out. It's just so that parents don't fight with us saying that our policy states one thing, even though the state of Connecticut states another thing, because our letters that we send out refer to our policy by number, and our policy does not currently match state statutes. So
okay. All right. So if no board members have any questions, specific questions about that policy in particular, I say we go ahead and pass it for a first read to the board. Jody, do we need to vote on that?
Yeah, let's just go ahead, Sharon.
No votes on that.
No votes. Okay. So let's move on then. Go ahead, Kristen.
Okay, so the second one is the update of the medication administration policy that we currently have in the district. January of 2022, there were new statutes implemented in the state of Connecticut that school districts are encourage strongly to have Narcan in our districts. We have, according to what I've gleaned from looking through all the records from the previous supervisor, we've had Narcan in the district since 2017, but we do not have a Narcan policy. I did recently have our medical director sign orders and sign off on procedural document for nurses to administer Narcan in the district, but we do not have a policy that matches our procedural guidelines that we have for nurses right now. So this language is just updating our current medication administration policy to include the Narcan, because that was not previously in there. And there is a big push from the state. I just finished the Narcan survey for the district, and they do want Narcan in every school. It was previously only in the high school and the middle school. They are pushing for it at every school because there is that risk of, the smaller people picking up a pill, putting it in their mouth and having an overdose. And Narcan does not cause any damage. There are no side effects. The only side effects from Narcan are the withdrawal symptoms that people get if they are addicted to opioids. So it's a very innocuous medication, and it can save lives in people who are overdosing. I left all the broad language in this policy that was suggested by the state because the rules are very quickly changing to make it more accessible to everybody, not just school nurses, not just administration, but also the public. And that's the push that they're making. They want different places pretty much in every town to have some sort of dispenser for free Narcan. I'm not pushing for that right now, but I did put the language in there if the town did decide that they wanted to have something like that on school campus. The state is also pushing for Narcan to be available within the AED boxes that we have on campus, because anytime you have an emergency where somebody would require an AED, one of the potential reasons for that is an overdose. So we did put currently, based on our signed order from the doctor, we do have Narcan in with our AEDs at one location in each school centrally located, with a sign on the AED box that it is currently available there. So it's essentially just getting us up to speed of where we were supposed to be working towards in 2022 is where this language is coming into our policy.
So we currently do have Narcan in.
We have Narcan in each school, limited doses. I only have in the lower schools 1 dose of Narcan in each school. All of my nurses, I did just have them do Narcan training with the hub, and I do have a follow-up meeting with the hub tomorrow to discuss. They wanted to just have a discussion with Weston because I think that they've reached out in the past and haven't been able to set up a meeting. So I do have a meeting with them. They were the ones that trained us in the administration of Narcan. They also provide free Narcan for the district, so it would no longer be a line item for us to purchase for the schools. So I am requesting free Narcan for all of our schools so that we can have multiple doses in case there was, let's say, multiple students that were exposed to a narcotic. We would have available doses, because you sometimes do require 2 doses depending on the amount that they were exposed to in order to get them to revive or stay revived. So hopefully we'll never need that. But I would like to have it in district and have all of our policy match so that we are covered if we do ever have to administer it.
Is Narcan perishable?
It does have an expiration date. It's a 3-year expiration date. I wouldn't keep it outside in the freezing cold or in the sun, but it is kept indoors in the nurse's station and in an indoor AED location. So it meets the manufacturer recommendations for storage where we currently have it.
Kristen, I have a question for
Yes.
you. How long, and I ask this for logistics, how long does it take, or how long does a person who's overdosing have to have Narcan administered successfully? Like, I'm asking because,
within a
high school
time
is
frame?
sprawling. Yeah, it's a sprawling high school.
Meaning, like, if you are assuming that they're overdosing, like, what's the time frame to get the Narcan into them?
Yes.
Limited. It depends on what their status is. Like, usually you would assume that they're having an overdose if they have depressed breathing, if they have pinpoint pupils, if they have really low respiratory rate, and you would immediately give it. The recommendation now is if somebody is unconscious and having depressed respirations, to automatically give Narcan in the off chance that they're having an opioid overdose, because there is no side effect from Narcan. It's like shooting water up your nose if you're not having an opioid overdose, because the only thing that Narcan does is it binds to the receptors and kicks off the opioid so that it takes the place. Now, that can, in some instances, only last for 2 minutes. It will only revive them for 2 minutes, because if they're circulating opioid in their bloodstream, it can then, once the Narcan wears off, reattach the opioids, and then they have another overdose. That's why we always immediately call 911, give the reverse, start CPR if necessary. If the first one worked and they start overdosing again, you give the second dose in the other nostril. By then, hopefully, emergency medical services will be there.
Yeah, the reason I'm asking is because one of the things it talked about in the policy was, the storage of and accessibility of it. And again, the high school is a sprawling place, and God forbid we have to. I think we have had to use it in the past,
right.
But hopefully it's not going to be something that is a common occurrence. But is it feasible to just keep it in the nurse's office if, say, something is happening in the far reaches of the school?
Well, that's why I put one by the gymnasium, because I feel like most of a lot of students are over there, and then there's one in the nurse's office. We can talk about, if we wanted to, putting them in each AED if we wanted to do that, but they're $50 for a pack of 2. We're most likely not going to use them, and we just need to see what's economically feasible, what we think is necessary. Anywhere in the school, if you're running in an emergency, it does not take very long to get from one end of the school to the other. I did a slow walk when I was checking the AEDs to see, how long it takes me to get from one corner to the other, and even at a brisk pace, it's not a huge amount of time. So anytime you are having that sort of, it's in our go bag. So the nurse would be taking it with her. It's not like we'd have to think, oh no, I forgot the Narcan. It's in our go bag. So if anybody were to say, somebody's unconscious, come help, we take our kit with us, and that includes the Narcan. But, in there, you would have seen also that if a nurse is not available, either myself or the nurse or a substitute nurse, we would let the administration know, hey, tag, you're it. This is the go bag. This is where the Narcan is in case you need it. Just like we would do with anything. If the nurse is not there, we always communicate with administration and give them training on, what needs to be done for different medications if they're going to need to administer.
And do we have the QR code available that was mentioned in the policy as well, where in the AED where it's being stored so that they can utilize the QR code to get instructions for application?
I actually have instructions with every Narcan inside the packaging. So it's a pictorial as well as written, so that when you're in an emergency, you forget. So you want to have that visual reminder of what to do. So I do have visual cards in there with step-by-step, 1, 2, 3, what do I do? So that's in there as well.
Are all staff trained to know where the Narcan is as well?
Right now, currently, no, because we were just making this policy. I didn't want to start training everybody until we had the policy in place, because I didn't want to get in trouble. I wanted to make sure we had the policy in place so then I can follow the policy, so that I can train the staff appropriately. Right now, all my nurses are trained, and I have the MD sign off that the nurses, and they did sign off that delegated staff can also give it. So if we weren't there until this policy is put into fruition, into implemented, I can train according to the doctor's sign off. I can train a delegated administrator to give the Narcan. But right now I didn't want to make it too broad because we don't have a policy in place. So that's why I'm trying to, get all my ducks in a row so I can do more broad training for staff that want to be trained, because realistically it's an easy medication to give and it can be life-saving. So the more people that are trained, the better, in my opinion.
Okay, and you said Hub is actually providing it for free. So
Hub
we
is
might be
providing
able
for
to
free.
avoid-
I have so far requested. I'm going to talk to them tomorrow and see how much they're willing to give me. Again, it does only last for 3 years, so I don't want to ask for their supply in case it's better utilized in other districts. But I am at least requesting 8 boxes of Narcan, which would give us 16 doses because there's 2 in each pack.
Okay,
And we also have Narcan. We also have 6 Narcans currently in district that don't expire until 2025. So.
okay. All right. Any other questions? Sorry, Kristen, I was peppering you there.
Sorry.
Sorry.
Was that you, Sharon? Just want to pick up on what Sharon had said. So I wasn't sure, when I was reading this, if we were putting in the language to sort of catch up to what we were already doing, or if this was sort of new policy that then we were going to put into effect. It sounds like sort of a little bit.
So it's kind of like we're kind of in between. I haven't trained staff yet because I wanted to wait until the policy was implemented before training broadly. All the nurses are capable of giving Narcan. All the nurses are trained in giving Narcan. And we do have Narcan available in the district, but we are trying to get this policy through so that I feel more comfortable training delegates within the school that can act, if they feel that somebody's giving, and another thing that we have to consider, the language says it's during school hours only. So it's from, high school 7:30 until 2:30. And at the elementary schools, it's, and that's for staff administration. So like if I were in the building and it's after school, obviously, I mean, by the policy, I'm not supposed to give it. I'm just supposed to call 911. But the state is asking us to make it available. So would I not give it just because the policy says that? I mean, probably not. I'd probably, give it. But
right. So my 2 questions were, and it's funny you brought that up. So the difference between during school hours and after school hours, it looked like after school hours, no matter what was in play, who was there, the instructions were.
And that's something that we can decide to change the language. Do we want to say there is an accessible one for people who are in the building after hours, because it is in the AED by where most people in the town access the gym area. That's where I thought it would be best utilized, since that gets the most foot traffic. That is something that we should discuss and see whether or not we change that language. I'm of the mindset that yes, we should change the language to say maybe during school hours, the one in the nurse's station, or like, it's not an expectation that a staff member during, after school hours, but if they're available, they can utilize it.
Yeah, it didn't make sense if you were available or a delegate, right? Let's say, wouldn't.
I think that's more for, and I'm not sure. The language is very quickly changing at a state level, and I'm not sure if the policy that was, recommended by Shipman, when it was exactly recommended, it might have been in 2022. The language now is really pushing for everybody in the whole state of Connecticut is recommended to have, Narcan, and it's not even a prescription anymore. You can buy it over the counter.
Well,
so it's very quickly becoming wide access. So I really,
are we teaching our kids in health class how to administer it?
I do not know that.
We have to find that out. I feel like
because that's something. I mean, they're pushing so hard right now for all the kids to understand the signs and symptoms.
The number of I think it's like 74% and above of all accidental drug overdoses are from opioids. That's why they're pushing so hard with the and there's been since 2019 there have been these combo drugs, including what is the name of it, Xyzoline or something like that, mixed with fentanyl, that looks almost like a Xanax, but it's and it's in pill form, and it's an animal tranquilizer mixed with fentanyl, and you can take 1 dose of that and die. It's very scary what's out there.
Narcan cannot be reversed, can it?
Can we talk about?
We're never going to get through these policies. I don't mean.
Okay, sorry.
But if there's some questions we can find out.
No. Can we go back and talk about if the school building is in use, regardless of whether it's school related, whenever because the buildings are used 18 hours a day.
Yeah.
If there's a qualified individual in the building like yourself at 8 o'clock at night, because you're there for a school play, you
Mhm.
should not be precluded from.
That's how I feel too. Like when I was reading that language, and I wanted to discuss that with the board to see what you guys felt, because I feel it would be ridiculous. Like I would use it regardless of what our policy said and then ask for forgiveness. But I think our policy should state like there is one available in the AED for
Okay.
whomever needs to use it.
But could we back up a little bit, please? Because I feel like, sorry, I maybe it's my brain, but what page are we on? What paragraph are we referencing that needs to be looked at closely? Is it page 18, letter C? Is that what we're talking about? If a board employee becomes aware of on school grounds, like we're talking about, what are you talking about adding or where? Maybe. I just am not sure where you are at this point with what we're referencing. Is it EC?
It's on page 18C. If a board employee becomes aware of a student experiencing a known opioid overdose on the grounds, but outside of regular school hours, it states there that we wouldn't act, but we would call 911.
Yeah, and I think I would be interested into why it says that, for the reason that you're talking about. We have to remember that these policies are broad policies. So school grounds could be, you could be up at Revson Field, right? And then if someone says, well, why didn't you run into the building? Go get that Narcan, go find it, do this and that, because you knew it was there. Some of this is a little bit of a slippery slope, and at times less is more. I'm just thinking what our lawyer says with regards to these policies. Clearly, if a coach knew and was in that situation, I'm sure that they would try to help. But I think we have to be careful with, to Steve's point, school grounds. School grounds is huge. So to me, call 911. Somebody's at a dance. They go outside. They're in the woods behind the tennis courts. Somebody keels over. Like, these are the things that when they write these policies, they're designed also not to be overly specific. I don't know if any of the administrators have any input on that, Tracy.
Yeah, so I think the language in this paragraph is supportive of what we're all talking about, because it says specifically that you call 911 if a school nurse or other qualified school employee is not available. So it's not about Kristen standing there not being able to administer it. It's if Kristen isn't around and if we don't have somebody else who could do it, the appropriate response is to call 911. So I think we're all on the same page, and I think this language is consistent with that.
Yeah, I would caution tweaking it anymore.
Okay.
That's just what I think. I think, look, everyone is trying to help everyone. And we do have to, I'll be the first to say it, we have to get a better handle on what goes on here on school grounds. Because sometimes situations happen, and to be blunt, we don't even know until the next day. Some parent might call and say something. It's like, why didn't the person in charge or anybody that knew didn't tell us? Luckily, nobody's been severely hurt, but we really have to, we have some work to do with that regard. And that's all part of the training.
Can I ask just one follow-up question? There was some language in here that it looked like it was in here, and now it was just stricken from the document with respect to buses and bus drivers, and what happened sort of in that regard. Now, I'm assuming it was.
That's because we don't employ our bus drivers. We
I'm
outsource.
assuming they're employees of First Student, and so then.
So it doesn't apply. I would have to train them if we.
Okay.
Yeah.
Okay. But do they have do we know if they have a policy? Does anyone know that?
I think what we need to find out are a couple things, and I've been taking notes. We don't know, and I'm going to call over there and I'm going to find out. Or Kristen, you call over and find out. We also have to talk to the PE Health CIL chair to find out, just for our own sense, are these kids trained? They're trained in CPR. Is this, I'm sure it's touched upon. I don't know if training is the right word, but are the students at the high school or middle school aware? Those are two things we need to find out.
Well, I guess the real question is there any reason not to train them?
There could be, yes. It could be because they aren't our employees. Like, I don't know. You know
Okay.
what I mean? It could be a liability issue, quite frankly. And where is the Narcan on the bus? I don't know.
Well, but that also applies to like EpiPens. Are the bus drivers trained to administer EpiPens if they have a child that's got an allergy on the bus?
Oh, I should look at their contract. I think
Yeah,
I have it right here.
that should be noted in their contract.
I think we need to come back to the committee with more information on this specific one before we move it on. That's just my thought.
Great.
Would that make you more comfortable?
Yeah.
Okay, so we're gonna table this for right now and then come back when we have more information about the administration by bus drivers and also about the after hours administration by board employees. Is that correct?
Unless we feel comfortable moving it forward, because it is a template and we can just get those answers and explain at the board meeting. I mean, if we want to move it forward, we should move it forward to the first read, promising to answer them on March 18th, if you're comfortable with that.
I think that would be helpful because I do think we need to have a policy in place sooner rather than later. That's just my feeling, and I'm worried about pushing this off. I think there are two very concrete questions that need to be answered. One is what role does this play in the health curriculum with our students? And the second part is what is first students training? Because to all of the points that have been made, we wouldn't be providing that training, but I don't know what the content of their training is. So I think we can follow up on those two items and be prepared. I can be prepared to answer them at the March meeting when we review this.
And I think that the other question that I would like to have, talking about after hours administration of the medication, if it's after school hours and it's a sporting event or something along those lines, I mean, I don't understand why a school employee wouldn't, if it's a life-saving time sensitive, application or administration of a medication, is it like an insurance issue? Why is it that we would not allow, or we would say it's against policy for a school employee to administer it if necessary?
Again, I just want to go back to the language of that paragraph. It says, and I'm going to read the whole thing because I think it's important. If a board employee becomes aware of a student experiencing a known or suspected opioid overdose on school grounds, but outside of regular school hours, and we don't have the materials available and or the school nurse or qualified school employee. So I think the language is broad enough. I think what this is getting at is if you aren't trained or prepared to administer this, you should be calling 911. If you have the ability to administer this, you can administer it. And Kristen, I think, explained that training can be provided to broader staff. Maybe coaches are prioritized, but we need to pass this policy before we do that. Is that consistent with how all of you are reading this and understanding it?
Yes.
Okay.
Okay.
Kristen, I would circle back right now and find out what Mark Berkowitz knows about any of this as it relates to the coaches. Because remember, he also sits on the Connecticut Athletic Directors Association. So he'll know for the whole state.
Okay.
I just looked at the contract. I don't believe there's anything in here about Narcan.
Is there anything in there about EpiPens?
No, there's not. So, and I don't know if that's a standard contract or not. It's just, well, Michael knows this. We're doing RFPs and things like that. And I've been looking at it. So I'm making a note on the RFP about what we expect about training.
I would also, EpiPens are key. I mean, kids who are allergic to bees get stung on buses. They need to know how to administer that.
Yeah, I made a note.
Thanks.
Okay.
Then the question is the child self-carrying their EpiPen, or is there an EpiPen available on the bus? Because you get into
Yeah.
that quagmire of,
Yeah,
is there an
it's-
EpiPen available on the bus? Because most time the kids leave their EpiPens, especially at the lower levels, in the nurse's office, and then they have one at home because they're not old enough to self-carry, or maybe they self-carry, but they're not old enough to administer.
Exactly. All
All right,
right.
so we're good with this one?
Sure. Yes, I'm in Tracy's camp. We need to get this out here sooner rather than later.
In general, just a broad question: are there any sort of good? I mean, we're talking about people administering medications, which of course, there's no written, let's say, authorization for any one person to administer it to any one individual. Are there like Good Samaritan laws that protect? Okay.
Yes, there was a Good Samaritan law passed specifically for Narcan and for EpiPens and things of that nature, and CPR, they're all there so that people don't stand by while somebody's, in distress for fear of being prosecuted later. So there are Good Samaritan acts specifically related to this.
Okay, and they don't need to be in the document because I didn't see anything.
No, it's state
Okay.
law,
Okay.
so
Okay.
I don't believe it needs to be in
Okay.
there.
Okay.
I mean, and to your point, we operate on saving kids and staff. I can give you an example. Years ago, principal of the middle school, it was me. Kid was a diabetic. My late husband was a diabetic. Kid needed that pen. There was no order for him. It was another kid's. It could have been like London's.
Yeah,
I took
yeah.
that pen and I said, just give it to him. And I stabbed him in it because I knew that we had to save the kid. I'm
Yeah.
not going to err on the side of, well, we don't have this pen for this kid. Oh, forget it, and thank God we did, because the kid, so the nurses and the administrators operate under that parameter anyway. I think it gets a little bit trickier when, you're talking about someone on a coach way out in the field or who knows where at another event or something, then call 911. But it's scary stuff. I mean, you want to make sure that people's lives are saved.
Yeah, I just wanted to make sure that there was something there
Yeah.
that people could rely upon just in case we weren't penalizing them for trying to help out in a dire
Yeah.
No, there's a Good Samaritan law.
Okay. Okay.
I think, Kristen, you actually carry the most risk because of your nursing license, don't you?
Yep. Yeah. So Good Samaritan doesn't really apply to nurses because we're licensed. So we have to follow the rules.
My mom
We
was
have
a
the
nurse.
same
She
thing
always-
as EMTs.
Yeah.
Yeah, my mom was a nurse. She had me trained. All of us, like, do not tell them I'm a nurse.
Yes. Yeah. I'm just an individual.
Anyway, okay, so we're good there. We're good. Okay.
We're good on those two, I think, right?
Okay. So you don't need my services any longer,
No,
correct?
thank you.
Okay.
We've
Thank
beaten
you.
you enough, Kristen. Thank you.
Okay,
All right.
Dr. Finkel.
All right, let's start with ages of attendance. Is that where we are now? That'd be great.
Yeah.
Okay, so some background for Michael, if that's okay. So last year, this age of attendance policy was on the docket for review and updating. We did this in conjunction with some of the field trip policies and regulations that we updated last year. We put it on pause because the state of Connecticut was in the process of updating the age requirement moving into this school year. So we kind of put it in the back burner and waited to see what was happening. So now that the state of Connecticut has updated the age requirement to enter school at age 5 by September 1, we felt it was good to put it back on the docket. So this policy and the regulations that go along with it have been merged to include the updated regulation and law that talks about admission before the age of 5, as well as the admission process after the age of 5. And so you'll see that the black, you know this, but for those of you watching, the black in the black text in the policy is what currently was in existence, and anything in an alternate color is the new additional language. What we do, or what I do when I meet with groups internally to update policy and regulations, we look at what our current practices are, and then we look at models of legal policies and regulations by Shipman and Goodwin, also by CABE, because they provide model policies. And then we also look at our districts around the state to see what some of their updated policies look like as well. So this is a merge of Shipman and Goodwin language from the admission process before the age of 5, as well as some language around the admission process for students after the age of 5 and the parental requirements if they are not going to register their children before the age of 5 into kindergarten. So what's the requirements if they're coming in after for grades 1 and beyond? And then also, what are their requirements to ensure that they are being educated, and how are they notifying the districts if they're foregoing, I can't think of the right word, if they're not coming into the public system, then what are they doing for them so that they are all accounted for and there's no issues with child find and so on and so forth. So you'll see that we then removed some of the procedures that were in here because those really were a regulation and not a policy. And we moved a lot of that language into an updated regulation, which you'll see that the R5112 reflects an actual regulation now, which is a model policy from Shipman and Goodwin regarding entry into a kindergarten once the child has been confirmed as 5 years old, and what our policy is if they're not 5 years old, and the parent is requesting a waiver. Do you want the other thing that I always look at too, just to give a further detail before I open it up, is we also look, and I don't know if you guys have already talked about this, but I also look at some of the additional policies that are referenced in the policy being updated. So if you look on the page, I'm sorry, help me out. What page is it? But the last page of the policy references a whole bunch of other policies that this one is linked to. So some of the work also requires us to look a little deeper and peel the onion back to see if there's any additional policies that need updating so that there's a common through line and a common language and a connection between an updated policy and any other policies that need to be updated as well. So for example, this 5112 policy also connects to 5111, which is admission and placement. And so if you look at the admission and placement language in there, we needed to update that as well to reflect dates and our current practices as well when it comes to placing students either in kindergarten or first grade and beyond. Some of those dates needed to now be updated because September 1 is the new entrance date and requirement for kindergarten and age 5. So that is why policy 5111 is also on today's conversation. Jody, I did notice a typo as well in the first paragraph of 5112, just for readability purposes.
Yep.
Third line down, at the end of school year age 22, we should remove all the way through years of age, comma, and who have not graduated from high school or vocational school, blah, 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 blah. Yeah. Thank you.
Got it.
Yep.
Tina, quick question for you. As I was reading through this, it was funny. I was like, well, what are the criteria here? Do we have established? And then it got obviously to the last 2 pages here.
Yep. The regulation.
On the regulation around the assessment and all. That has this process been put in place now? It looks like if people want to request an exemption, let's say, or early admission, they would have to have requested by March 1st of this year.
Yep.
So how many requests have we gotten? Do we know? Do you guys know how many requests we've gotten to date. Is there any leeway there? Is that a firm cutoff as far as March 1st? And then talk to me a little bit about the assessment that's dictated by the state. Do we have any, in terms of the criteria, do we have any license to amend or sort of, add to or fuss with that policy at all in terms of how we're determining whether or not they're ready to go into kindergarten if the parent is looking for an exemption?
Yeah, all great questions. So yes, Laura Cadis, the principal at Hurlbut, that's part of the reason why we put this on pause, because we were trying to understand what our current practices were in Weston, and what our comfortability level was, and what our internal capacity was to actually execute the regulations as defined here. So I met with her. We did have a long discussion around the current practice right now and the dates in which people have been submitting requests for waivers. These dates do reflect a little bit of flexibility and to give to the principal, as well as the parents, to give them some opportunities to request the waiver. So what I said to her was, most parents should know their kids' birth dates and when they will turn, if they will turn 5 by September 1, right? And so if they need a waiver, we've ensured that we've allowed enough time for Laura to go out into the preschools, which she does. She observes their academic and also social, emotional well-being and their readiness to enter kindergarten if they did not meet that five-year-old requirement moving into that following school year. We've had I believe there's about seven requests, all of which this year we were committing to approving all of the waivers. And we've been able to comfortably execute some of the assessment procedures, and they all would have qualified anyway. So we feel comfortable that regardless of what the law says, we try to execute the regulations, kind of see what the response was from Laura, and all of whom successfully are ready to enter for next school based on her assessment. We also wanted to make sure that we didn't start assessing students until as close to the end of that 4-year-old time frame as possible, right? Because you don't want to start assessing them in the fall because there's a whole year of growth, right? And that wouldn't be fair. So that's another piece of why we really tried to push it more towards that March deadline, and the assessment wouldn't start happening until after the winter break, and as close to the end of the school year as possible, while they're still in school and while they're in preschools if available. We do have guidelines. The state does provide guidelines for pre-K, and that's what the Connecticut Early Learning and Development Standards are, and that is what we use to anchor our observations and our assessment in determining whether or not they're ready for kindergarten or not.
And one last question for me. This ability to request a waiver, right? This is just for this year, right? This is just for the transitionary year, or this is going forward?
It's going forward too. So that's what this regulation allows for as well, just so families are aware that yes, you can ask for a waiver, but there is a process after that we've defined here on what we look for when we make our decision around readiness and whether or not we're going to approve the waiver or not.
Got it. Okay.
I have a question following up on Michael's, and that is, was it publicly, and forgive me for not knowing because I don't have a child this age, but was it publicly, or were the public made aware of the fact that March 1st was the deadline for this year? Because I know that this is a very hot button or hot topic.
So they've been communicated with since the new deadlines have been approved by the state. Laura has been communicating regularly in her week ahead, and there's also been letters going to preschools and communication to preschools. Okay. This year, we are, like I said, even though we're executing the regulations and the admission process as we see fit on the paper, we have been approving all waivers that come in. Okay. And we will likely continue to do that.
So it says March 1st. I just want to make sure that if, with this policy going forward, I understand March 1st can be something that we set in stone, but is it, if somebody comes and applies now, is it considered
Yes.
too late?
No.
Okay.
No, and they
So
have
we-
been, we have, most of the waivers right now have already been submitted because of the communication so far. And it would matter if a student is maybe moving in late into into town.
Yeah, exactly.
Yeah, that's
Yeah.
really where it might come down to. And I think that although we have, like to Michael's point, although we have these deadlines, Laura's very flexible, we are very flexible, and we will continue with that assessment to consider whether or not they're ready to move in, regardless of the March 1st deadline. We have control of basically saying, yes, we will respond to the waiver and we will continue with the assessment.
Okay. All right.
I think one of the other pieces that we talked about, and Tracy, I know she was there too, was that what if somebody comes in the summer and requests that waiver? That's part of, because we don't have necessarily any kind of background information or ability to go to schools or look at their the social emotional part if they are in a pre-K program. So in that case, we would have them come in and we would do our own internal assessment. I think just through those CT early learning and development standards, and do our own internal assessment and go from there. We do a parent survey. We could look at any prior documentation that they're coming with. But that might be the hiccup at this point. I don't know, Tracy, if you wanted to add anything maybe that I missed from that conversation, but it seems to have been working well. And I think the model policy and regulations that Shipman has provided has helped us frame a little bit more clearly around what our processes look like.
Tina, do we need explicit language in there about people who are moving in terms of being, providing flexibility to those that are moving into the district, that we would provide a later assessment?
So that goes to 5111.
Oh,
5111 connects to yes, if you've missed that entrance in kindergarten, and then what happens?
Yep. Okay.
Yeah. But I don't know if you guys, we may have not been going through this before, but we've revised policies in the past. So this is our first iteration of this policy and the regulations. We kind of piloted it this year. Now we've got it in writing. We're going to try it again for another year. And if for some reason we're recognizing that what we put on paper needs to be revised, we can always come back and make an update.
Do we have at the bottom of 5111, I'm taking a look here. There is no reference to 5112, is there? I didn't see one, because that was one of the things that I had noted in my notes. This is clarity for process.
We probably should then.
Yes.
Yeah. Thank you. Yes, we probably should add that.
Okay.
I'll make a note too. Okay. Jody, you have that too, right? Just so I don't forget. Yeah. Okay, I'm good with that one. Anybody else want to add? Or those two, I should say. One of the questions too I had asked of Jody, since we're on this topic, do we want to put a P in front of the numbers for policy and an R? Because some have them and some don't. Since we're working to make revisions, do we want to start doing this or stop doing this? It bugs me. It's just
I'm glad you asked that,
Starting to
because
do
I was
that.
sitting here going, what's the difference between R5112 and P5112? So, okay, I mean, if that's gonna be how we handle it, but how do we determine when does it stop becoming a revision and become a policy? And
well, no,
voted
P
on?
stands for policy in front of the
Right.
number, and R stands for regulation in front of the number. But some of ours have a P, and some of our policies have P's, and some of our policies don't have P's.
Yeah.
So I said to Jody, we either have them or we don't. And
Let's standardize it.
I'd like to, going forward, I'd like to include it just because it's an easy identifier when you bring up the document and you're looking at it.
Whether
I
it's a
would
policy or a regulation,
yeah.
state regulation. Okay.
So then 5111 needs to have a P in front of that one. Yeah. And then it looks like, oh, look, there is an R there. So
Yeah.
yes, I agree. Standardizing is important.
Perfect.
And Tina, just for my, satisfy my ignorance here, the difference between a P and an R specifically is that an R is provided to us from some federal or state regulatory body. Is that how are we making the difference? How are we determining?
Yeah, a policy. The P is for the policy, the overarching, policy aligned to the work of the topic that we're talking about, and the regulation is how we execute the policy.
Okay.
So the R in front of it are the steps and procedures within it that we're going to. That we're going to follow in order to ensure that the policy is done correctly.
I'm glad you just clarified that because that's not at all how I would have read it. So,
Yeah.
Thanks.
Mhm.
I'm not afraid to ask a stupid question.
No,
Thank
that's
you.
good. Nope, not at all.
Michael, I asked the same question many years ago. When I first started looking at these. It's confusing. No one knows, to be frank.
Yeah. I thought I had it down and I had a completely different understanding. So good job, Michael. All right. So I think we're ready for this to go first read unless anybody else has anything else to add in here.
No, let's do that.
Okay. Steve's like, move it forward.
No. And I apologize. I have to get in a car to go somewhere, but I'm going to just continue the meeting with you and just
Okay.
go on mute. Thanks.
All right. I think next we're going into what's coming up here. Tracy, this is going to be Tina again for review of curriculum material. Is that right?
Yeah. Before I go to that one, did we say we can sunset something while we're on? This is a quick one.
A sunset of policy?
Yeah. No, Lisa said no.
Oh, we hadn't.
Not
I
at
think it's part of the
this- not
agenda.
at this meeting.
It's
Not at
not
this meeting.
posted, we can't do it.
Yeah.
It'll be
Okay,
a
we
quick,
didn't put it on
we
there?
can't do it.
Put it on the next one for April.
Yeah.
Okay. Okay, good.
We had so much to go over here that just the
Got it.
explanation on
Nope,
that.
It's all good.
All right, thanks.
I didn't follow up with them after. I had a whole bunch that I wanted to try to clean up, and I wasn't sure what made it on there and what didn't. Okay.
Yep.
All right. So the next policy that is up for revision was one that was written in 1991.
Very current.
It was a blue and yellow type. I think a typewriter wrote it. And it is the policy 6161 and regulation 6161. This policy is specific to instruction and focuses on equipment, books, and materials. You'll see that some of the language that was in there before, which is in black text, is extremely outdated and does not reflect our current practices in the district. So full disclosure, I did gather a large team internally, which included library media specialists, administrators, our literacy curriculum and instruction leaders that focus on literacy. And we really had an open dialogue around what does the language in the policy and regulation say? What do we currently do when it comes to curriculum adoption and making decisions around resources that are for classroom use and also resources for enhancing the learning experience for students. And that's beyond just texts, because in here, like the word textbooks, it's very outdated, right? I mean, when somebody hears the word textbook, they think this big, massive social studies book, right? And we've really moved beyond that in the world of 2024. And so also we wanted to make sure that we had some opportunities to talk about, all of the instructional materials that are beyond just a book or a literary text, but also what are some of the digital tools that we use in the district as well? What are some of the databases? What are some of the videos or online materials that we use to enhance the learning experience? And so this took a little bit of time because when you get a large group around the table talking about curriculum and instruction, sometimes, everyone goes in different directions. So we really looked at some of the Shipman and Goodwin policies. We looked at CABE's policies, and we looked at a ton of current policies around instructional materials from Darien, from Westport, from Fairfield, from Guilford, from Trumbull, from Monroe. I mean, there's tons of policies out there. Some were outdated as well, and some were updated. Darien probably being the most updated that we looked at. And so what we also wanted to have a discussion around was in the initial policy was we defined this policy related to instructional materials. It was a very large, broad term, instructional materials. And what most of the policies had was a delineation and or a definition more deeply around what instructional materials really meant. And so when we looked at some of those model policies that were out there, we were very comfortable with these two terms, instructional texts and educational materials. So you'll see that instructional texts are the instructional texts that are really linked to curriculum, right? Our curriculum units, the programs that we have adopted in the district across the different content areas. It's basically what's directly linked to the curriculum design and the units of study that our students engage in from kindergarten all the way up to 12th grade. The educational materials are above and beyond that. So those would be those educational materials that are in the library, more about like interest, passion. They're not connected to a unit of study in the curriculum. It could be supplemental print or digital materials. It could be the online databases that we provide students when they're doing research. It could be any video or multimedia types of resources that are available to students and or to the library media specialists when we're talking about enhancing the learning experience for students. So with that in mind, we've revised and updated the policies to reflect this idea of instructional texts and educational materials, because it was kind of lumped together and it was never defined in this policy. So that's basically the first page. You'll see that the black text is what was originally there, and it was very simple and very vague. And we wanted to provide a little more context around what we defined for instructional materials.
Can I ask just a generic question?
Yes.
The generic question is, the last time this was updated, did you say it was 1991?
Yes, sir.
So, and kudos to you for taking on this massive project. But what are our plans going forward in terms of, I mean, think about that, 1991. My math isn't too good, but that's a long time ago. And what are the thoughts about reviewing these policies just across the board more frequently than we do? Because we keep hearing 1991 or 2002 or 20, 30, 40 years ago without. Go ahead.
So we have a list of all these old policies, Steve. And to be perfectly, we've been trying to chip away at it, and we're still chipping, is all I can say. Jody has a list. It's very, quite frankly, disheartening to go in and see policies that have not been updated. So we will just keep at it, but we start really with the big important ones. This is an important one.
No, my point, I'm as I said, kudos to you for taking this on, but we should, as a board, be saying, you can't wait 20 years. I mean, policies are dynamic. They're not static.
Yes, that's correct.
Yeah. And to your point, Steve, it takes time. And because we are in the thick of these policies and regulations to implement with fidelity and integrity, it does require us to have conversations and dialogue with a variety of different people to ensure that what we put on paper is actually matching what we do. And I think that's part of this work too when we bring these important policies forward.
I would equate this with the capital improvement plan. Delays, and somebody not looking at it, to be perfectly frank. Ultimately, it's the superintendent's responsibility to make sure that these policies are updated in a timely manner. And that's what we just have to keep going forward. Because believe me, the first thing I do whenever I look at a policy is I check the date. And I think we have made great strides, and we just have to keep on it because we can't fall behind. Luckily with Chipman, and years ago, I don't know if they had that resource, we get updates. Jody is relentless in her pursuit of updating policies, I can tell you. And Dr. Henkel, again, is to be commended. Like, if I let Dr. Henkel loose, she probably would have a whole day of meetings where we'd be going through other policies. So we're trying to pace ourselves, but it's it is a concern.
No, but as a board, Michael and Sharon, I think we probably should talk as a board about having a rule, that policies will be reviewed on a period, whatever the, right period, every 3-5 years, not every 10, 20, or 30 years.
I don't disagree with that, Steve, but I think that there are a lot of current policies that have been updated more recently that have to be updated again and again. So it's I mean, how many policies do we have? That's the other thing.
And sometimes the updates to the law push the revision. Right. I mean, if there's a new, like the bullying policy that we updated, that was because it wasn't outdated. It was because the law updated. So we had to reflect that.
And same thing with age, what we just went through, and the medication with the Narcan and things like that. So maybe what we try to do is we try to tackle, at least one aged policy a meeting or something along those lines, something that's, pre-2000. So we can try to do it. But unfortunately, I mean, it's just an overwhelming job to try to update everything, within our board term.
And
yeah, but just recognize we're in a litigious environment. And
yes,
that's just the reality of life. So if, it will be a big task, but we just can't say, well, look, I think policies should be reviewed on a timely basis, whatever that timely basis is.
Yeah, look, I think Steve, to your point, I think it should be some sort of standard cadence, right? We review a policy, we say, okay, we're going to review it in, let's say, 3 to 5 years, like you said, but it's got to be the sooner of we're compelled to review it because of some regulatory change, or we're just going to hit it on the standard cadence, right? So, for example, this policy, we'd say, okay, well, all right, we're reviewing it now, we're updating it. 3 years from now, we'll review it again, unless compelled to do so sooner, right? Mm-hmm. Something like that. And so this may come up again next year, for example, but if it doesn't, we already have sort of, as per our standard cadence, that we will review it in at least 3 years. Something like that, I think, is probably something the three of us should talk about.
That's not a bad idea. I'm just concerned that 3 years. I mean, something we have to be
5 years, 3 years, whatever.
Yeah.
It is. Yeah.
We just have to be realistic with the amount of time. So I agree with what both of you guys are saying. But but back to this policy in particular, I'm curious. It looks as if obviously the majority of it is red, and that's primarily because it was, so old. But the other thing that's red is, for example, I'm looking at Appendix A and Appendix B. And do you want to jump to that, or you?
Oh, yeah. Okay, so let me give you some more context,
please.
Okay, so I want to call your attention to the policy 6161 and the regulation. So we've now kind of matched what we do in Weston when it comes to adopting instructional texts. So for example, the American Reading Company, we adopted a new core resource for the district. We had a committee that came together. We had a whole list of things that we were looking for to vet the quality of the different resources, which is part of the regulations. And then who's on those committees, who's helping us make those decisions. And then we make our decision and we bring them to the curriculum committee, the subcommittee, and we present those to the Board of Education subcommittee meeting based on the regulations, right? So this is kind of like the the proactive measures to be very transparent on how we make decisions, what we look for, who's involved in that decision making, so we can have open dialogue with the community, with our staff members, with our administrators, and we're all on the same page, right? You all can also have that conversation now with the community members and so on and so forth. So what happens if there is a question regarding any of our decisions, right? There's always an opportunity to ask for a reconsideration, which is connected to policy 1312, right? So there's a complaint policy, right? And with it, which this is linked to. Because if somebody has a complaint around this policy and regulation and the decisions we've made, there's always an opportunity to hear people's voices. And Lisa and I have been executing and working on this all year. And so if you go to policy 1312, in our policy as it stands, there's language in there that says specifically for instructional materials, if there is a request for a reevaluation of the instructional materials, which we now have defined because we didn't have a definition before. So we now defined what instructional materials are. There's language in there that says you have to fill out this form, this complaint form. I say the word complaint. I should not be using that. This reevaluation form. And there's language and procedures that say I have to create an ad hoc committee and we need to reevaluate what you're requesting on your form. And then we have to fill out a report and we submit it to the superintendent based on our findings. There was no form and there was no report. So this is now additional forms that will now accompany the regulations of 1312, which is linked to the instructional materials policy that is in front of you now.
If I may add, we also had a test case with this.
Yeah.
With a gentleman that had come to the Board of Ed about that, you might remember. And the policy worked beautifully. Everything, it was so helpful. Dr. Henkel and I met with the gentleman and went through everything. Everything is good with regards to that. And it's a testament to how important these policies are when they're living and breathing documents and they provide the guidance of how to process these kinds of concerns, if you will. But really, I had to just give you a shout out. Well done.
The communication, I think we appreciate when parents are so vested in their child's education and they ask pertinent questions, all good questions. And they make us also reflect on our decisions and our practices and our processes, which we did. And we had an opportunity to have an open dialogue with that parent. And it was fantastic. We all learned a lot and we did make some revisions. And in the end, the superintendent accepted our report and our recommendations, and the parent agreed with them as well. And so it worked. I mean, so it was actually a nice conversation and a fluid process, which now is reflected in these updated documents. We didn't have these currently in existence. So if somebody went to that policy and regulation, there was a disconnect. And it was a disconnect for us internally. We were like, well, where's the form? I was like, I don't have a form. Well, where's the report? Well, I don't know where to put all this information. So now we have an updated policy and updated regulations, and they're all connected to each other.
So 1312 is then referenced back to the 6161 Appendix A and Appendix A, correct?
Which
1312. Okay.
Yes, it should.
Okay, I see it there.
Yes.
Sorry.
Yep.
All right.
Right. And so we did that loop too. We were like, well, let's go back to this is how it evolved, right? We went back to 6161 and we were like, oh my gosh, this policy hasn't been updated since 1991.
Right. Okay.
So we were like,
Gotcha.
oh boy, we need to get on that too. So there was a lot of moving parts in that process. So it was actually such a great experience that, we had a parent that came in and had a conversation about something we wanted to reevaluate, and all this kind of happened, and we
That's
were able
great.
to update it. Yeah.
Yes, and
it
we
was.
gained a sub for the district.
Always an ulterior motive.
Yeah, the person now volunteered to substitute.
Oh, that's fabulous.
These are win-win situations.
Lisa, quick question for you. The form here mentions basically an evaluation of the instructional materials. Okay. What if a parent, if you've gone through, let's say they've filled out the form, you've spoken to them, you both have deemed that, let's say, the instructional materials are appropriate, and then the parent disagrees and requests an opt-out. What happens in that sort of case?
Go ahead, Lisa, you
Dr.
can
Engel,
start.
you want to speak to that? I think there's only certain areas where someone can opt out of like a topic being discussed in health or something like that.
There's a
correct?
couple layers of this, right? It's not
Yeah.
so black or white. Yes. A parent always has the option to not allow their children to read a book, or not allow their children to engage in an activity. What we don't do, though, is we're not required to provide alternate activities, but they can just, do something. They could just not participate in that one. And there are laws regarding the health and PE requirements as well. There are certain units where parents can refuse to participate in some of the health specific ones, especially when they get to middle school. Because if they want to engage in that conversation at home about sex and about other aspects of the health curriculum that we started talking about, and drugs and health related pieces of the curriculum, specifically in the upper grades. Yeah.
But I'm sorry, I will add one thing. I think that there's policy and regulation, and then there's also practice.
Yeah.
And what we try to do, and I think we do it really well, and it speaks to, we talk about personalized level in a district. We spend a lot of time working individually through issues like this. I'll give you an example. When I first came on board here, there was a parent that was very concerned about some of the texts that were being read at the high school, just like 3 texts. And so I spent a great deal of time, and there could be a situation where you end and you agree to disagree. But to me, I was like, okay, we're developing a skill, and what are your concerns? And and I said, what's the student work that we're requiring? What's the task students are requiring to do? And when I was able to show the parent, because we keep samples like, this is the assignment, this is the task, this is what the student prepared, they develop a better understanding when we spend that kind of time, as we did with this last situation, listening attentively and trying to figure out how we can get some common ground here. Now, are we going to put all that specification into the policy? No, but that is the expectation. Because people, I've learned over the years, might want to opt out or might be uncomfortable about something for reasons that we need to understand. We may assume it's one thing, and then it turns out it's not, it's something else. So if there is a way that we can work with families, we will always choose to work with families and spend the time necessary, because that's who I think we are as a district. Are we required? No. But would we do it? Of course, because I think that's our responsibility.
Right. So I didn't see any language about it in there, and I was just wondering if there should be some language in terms of opting out, but up to the discretion of whoever, let's say, in the administration. As I know, a lot of this sort of comes up with, some of the materials that are out there. I think, parents have been, very sensitive to some of the things being taught, just not here, just in general, but this is more of just a general sort of sense that I get from people. So I understand we're trying to be, look, we're a small community, right? We're a small district. We're going to do whatever we can, of course, to try to work out any differences. should there be anything in there? I'll direct this to Lisa and Tina. Should there be anything in there in the actual document in terms of just a generic look? Should that come up? Of course, that requires further discretion, and our discussion is ultimately up to the discretion of the superintendent, the assistant superintendent, whoever it is. That's my only other question on this.
Yeah. Perhaps we should go back and revisit that, Tina, and see.
Yeah, I'm
Get a
looking.
little bit more, put a little bit more thought and reflection on, should we do it? If we were to do it, where would it go and what would the wording be? I just want to be careful.
Yeah.
Yeah.
My first thought too is what comes up a lot with opting out sometimes is state assessments. And by law, there really is no opt out.
I would imagine there are core issues, right, Tina, that
Yeah.
you cannot opt out of, right?
Yes.
But then there are also sort of, let's say, these ancillary, let's say, educational materials or projects or whatever have you, that there is maybe some flexibility as you try to work with the parents. So
I'm thinking also about what happens when there is, to Lisa's point, a concern or a question. We never jump right to this policy like this, right? It's always, we start with, even with testing. Like, remember when Smarter Balanced years ago, there was this big hoopla about that the state was going to sell student information and data, and everybody was like, no, then I don't want my kid to test. Like, it was wrong. That was so false. But what happened, what evolved from it was that, if you attend a public school system, there are mandates and requirements that being a student you're required to do, one of which is taking the Smarter Balanced assessment, and another is taking the SAT, and another is taking the NGSS, right? However, if a parent is refusing, it's called refusal to test. If they're refusing their child to test, then we have a conversation. We call them up on the phone. We have a conversation about the why behind the concern before we can move forward down that road. And I don't really see this as different because, you're part of the public school system. There are standards that we are expected to deliver and implement through our core curriculum. And when there are specific units, because it could be just a unit of study, not necessarily like, I don't want my child to participate in sixth grade math. Like, you can't do that, right? So then then there needs to be a conversation around, like, what's the concern around, what's the animosity? How can we support you and your child to feel comfortable and give you an understanding of what they're actually going to experience? And 9 times out of 10, it doesn't end in refusal because there's just not an understanding or an awareness.
Do we have a policy surrounding refusal?
There is law. There is no law because there is no policy because it technically is against the law, and the state of Connecticut will give you the law.
So it's against the law to.
We are
say you don't
legally
want to-
required to offer students the mandated assessments that the state requires all students to participate in. And there is a requirement of participation, a percentage of participation, as you all know, because we've talked about this.
Right.
So by law, there really is no opt-out or refusal, but parents have the ability to refuse their child to participate. But the district is required to continuously offer the test to the child. And if they decide to sit there and do nothing, then that's their refusal.
Okay. But I'm talking about outside of tests. So, for example, I think what
Oh.
Michael's probably pointing to is, a point in the curriculum that the parents disagree with, right?
We don't have, not that I have seen, but I can look deeper.
Okay.
I do not see a policy related to like refusing to participate in the educational program
Right.
that Weston is providing to the child, to their
We'll
child.
say, for example, with sex education in health, their parents have the ability to refuse, or how's that?
Before
what
those
policies
units of
covers that?
study are being taught, this is beyond policy and regulation, right? This is best practice. So
Okay.
before any of our units of study that may be controversial
Mhm.
or have some emotional context to it, a letter goes out to the families from the teachers, letting them know before the unit of study is being taught that the certain content or standards are going to be taught in this unit. What's your comfortability level regarding it? Please call me if
Okay.
you're comfortable with this conversation that we're going to be engaging in.
Does
Yeah.
that seem to be sufficient right now, or is that something
Yeah.
that we? Okay.
Yeah, it seems
I don't
to
want
be
to
working.
create a problem where there
Yeah,
is
no,
one.
it seems to be working. And for those parents that are very aware of what the content is specifically in middle school, when that letter goes out, they give a call and we make adjustments and we respond accordingly.
Okay.
And it's since I've been here last year, it has evolved already and it continues to be.
Okay. Michael, you were saying?
Yeah, no. I was just going to say, I think you answered the question, Tina, but in general, I was just going to say, yeah, I wasn't even thinking about testing. It's a good point. I wasn't thinking about testing. I wasn't even thinking about units. I was thinking about lesson plan, like, topics within units.
Yes.
If
Right.
someone wanted their kid to opt out of that. And I guess it's just a matter of understanding the difference between core, what's basically you cannot opt out of, right? For example, standardized testing or whatever have you, versus, let's say, individual topics that people may be uncomfortable with their students or their kids participating in. Is there any flexibility that we put in the policy just to say, hey, look, yes, in certain circumstances there's the potential for that, but obviously it's at the discretion of the
Yeah. And I would caution us because we are a public education system that is required to teach and align curriculum to the state standards, which we do.
Right.
And so it's part of our policy to provide high quality education aligned to those standards because we're a public school that is required to do so.
Right.
So I do think by adding that to a policy in a way, it creates all these different opening doors. And I think it's better suited if we deal with them individually based on the concerns between the parents and the students.
Perfect. One
Yeah.
less policy.
Yeah.
From the policy committee. Okay.
So I don't know how to, so just one thing is these forms are connected now to Appendix 1312.
Okay.
Okay, so that's we need to review and adopt basically to that policy. And then separate to that is the revisions and updates to policy and regulations 6161.
Okay. All right. That seems to marry it together nicely. And that took a lot of time, clearly. So thank you for doing that, Tina.
Yeah, it looks great. I really think what we came up with could be a model for other districts. It looks great.
Yeah.
We did a great job.
Awesome.
Mhm.
Awesome.
It was pretty cool.
I think that if any other board members, any other thoughts, or are you comfortable moving it to first read?
Yes.
All right. Steve, Steve's still here. Is he gone?
No, I'm right here. I'm fine. Yes.
Are you comfortable moving that to first read?
Yes.
Okay. Awesome. All right. Thank you, Tina. That's fantastic.
You're welcome.
Let's see. So that was discussion internal process to select instructional materials and educational materials. That was all part of it, correct?
Mm-hmm.
That's not separate. All right, good. So now it's just future meetings. Next agenda item is discussion of policies, regulations, and bylaws in future meetings. I think we're going to have, we passed everything on for a first read. So hopefully, I know that I spoke with Dan DeVito, and hopefully and Lisa was bringing it to the administration, a policy that CABE has passed recently regarding AI and the use of AI in schools. Lisa, do you think that's going to be ready for the policy committee next meeting, or is it too soon?
No idea. It's on we're reviewing tomorrow at 4:10, the AI CABE model policy as a group. So we'll have a sense after that.
Okay.
We may even just bring it forward to begin the discussion. I don't have a problem with that. But that might be useful. And then you can hear what we discussed, but I want to caution that it's going to be done like that, because Dan really liked the policy, but I have no problem putting it on because we're talking about it this week, but I think based on the discussion, we'll have to see where we're going with it.
Absolutely. I really would like to start addressing this sooner rather than later. AI is moving faster than the speed of light, and I don't want to be caught behind this. So if we can get this, it's at least some sort of a policy put together sooner rather than later, that would be good. And like you said, Dan was very enthusiastic about this form of the policy too. So I'd love to see that. And then Jody, moving forward, if based upon the conversation that we had earlier, if you see that we've got a light, or if we figure out that we've got a relatively light agenda, let's start going after policies. And even if it's just to read through and saying, what, this still stands today. It has now been revised as of 2024. That would be great.
And we also have one or two that we're going to be talking about here just to sunset and bring to the board. So I'll include those as well.
Okay. And if you could next time, instead of 60 pages of text for us to read before the meeting, if you could just bump it up to about 80 to 100, I think we'd all really.
I think I can certainly accommodate that without a problem. Trust me.
Easy. Anyway.
I know I felt so bad about that.
All right. Any other questions or anything else anyone needs to discuss that's on the agenda?
No, other than Tina.
Motion to
Jody,
adjourn.
Hold on. Steve, you're saying no other than Tina what?
Jody and Lisa, thanks for all of this. It's an enormous amount of work.
It is.
And long overdue.
Yeah.
Yes, thank you.
Thanks, guys. All right, great. So can I have a motion to adjourn then?
So moved.
Great. Second?
Second.
All right. I'm sorry. The next meeting is April 4th. No, April 2nd.
Yep.
All right. So the next meeting is April 2nd.
Perfect.
And everyone have a great month. Not that we want to see plenty of each
Thank you
other
so much.
between
Have a great day, everybody.
Thanks. Bye-bye.